Thank you for choosing Good Samaritan Hospital for your joint replacement. Today, we're going to give you as much information as possible in regards to what to expect prior to your surgery, the day of your surgery, over the course of your stay at Good Samaritan Hospital, and what to expect after you leave the hospital. Our goal is for this to be a very positive experience for you here at our brand new Total Joint Replacement Center. We are here to help you heal and change your life. The Good Samaritan Hospital Joint Replacement Center is run by a comprehensive and competent multidisciplinary team. Dr. Arut Badra is the director of the Total Joint Program. Dr. Richard Clarkin is the chief of anesthesia. John Balancione, RN, serves as the service line director for orthopedic services. Jennifer Cassidy, RN, is our program's total joint coordinator.
Lynn Keith, RN, is manager of same-day surgery and PACU. Janine Andretta, RN, is manager of T4, our brand new orthopedic wing. You will also meet with our physical therapy department to aid in your recovery. Additionally, case management is there to assist you with discharge from the hospital and any anticipated needs you may have, such as a walker, arranging PT at home, and if needed, home care to provide a nurse to visit you in your home.
During your stay, you will receive both physical and occupational therapy. Our primary goal is to create a plan of care in preparation for a safe discharge home. PT and OT will review how to prepare yourself and your home before surgery. They will also educate you on what to expect after your surgery with both physical and occupational therapy. They will review equipment you may have or will need, and they will review your home setting and the level of assistance you will need prior and post-surgery. Remember, this is an elective surgery. You'll need to prepare meals in advance. You also need to prepare your home. This means to remove all decorative items and throw rugs, as can be hazardous. Make sure you have a clear pathway to your kitchen, bathroom, and bedroom. You need to arrange for a caregiver for you when you return after surgery. When you are discharged home, you'll be provided with home therapy. Take advantage of the time you have with the physical therapist. Review stair climbing, bathtub transfers, and bed transfers. For pre-admission testing, you will come into the hospital and meet with a nurse who will perform a thorough health assessment. You'll also meet with a hospitalist. It is the hospitalist's job to manage your care while you're at Good Samaritan Hospital, as many of your private doctors do not come into the hospital. You will also meet with an anesthesiologist to talk about the type of anesthesia that is used in your surgery. It is important to inform them if you have had any trouble with anesthesia in the past. You will have blood drawn, an EKG, a chest x-ray, and likely a CT scan of the joint being replaced. It is also likely that you'll be meeting with Jennifer Cassidy, the total joint coordinator. Please allow 3 to 4 hours to be at the hospital for PAT. You do not need to fast, and you can use our complimentary valet service that day. The day of surgery, it is very important to give the nurse a list of all of your medications and to notify them if you have a metal allergy. Metal will be going into your body. If you have a skin irritation from different metals, please notify your nurse, as you may need allergy testing. Types of anesthesia. For a total knee replacement, the anesthesia predominantly used is a spinal anesthetic with a long-acting local anesthetic. For a total hip replacement, the anesthesia predominantly used is spinal anesthesia with a peripheral nerve block. For total shoulder replacement, the anesthesia predominantly used is a regional nerve block with general anesthesia. Please note if you take any of these medications that increase bleeding: Coumadin, Xarelto, Lovenox, heparin, any antiplatelets like aspirin and Plavix. Herbal supplements can also cause bleeding. It's important to disclose all medications that you take. Many over-the-counter herbal supplements can cause serious bleeding problems. A COVID test will need to be completed 5 days prior to your surgery. Pre-admission testing is completed first, followed by a COVID-19 swab just before the surgery. The day before your surgery, drink plenty of fluids, preferably water. This will help you stay hydrated and makes it easier to start an IV on you before surgery. If you're on fluid restrictions as prescribed by your doctor, please follow your doctor's instructions. Please do not shave your legs or underarms or use any chemical hair remover the day before your surgery. Tiny cuts and nicks, even microscopic, can lead to an infection. Your surgeon's office will notify you the day before surgery as to what time you are to show up. This time allows for work at the hospital staff needs to do to prepare for your surgery. It is generally 1.5 to 2 hours prior to the start of the actual surgery time. Do not eat or drink anything after midnight. Your surgery will be canceled or postponed if you do. This includes no gum, candy, or mints. The only exception to this is if your medical doctor, surgeon, or anesthesiologist has told you you need to take medications the morning of your surgery, such as blood pressure or diabetic medication. You will want to shower or bathe. You will not be showering for several days after your surgery. 1 hour after you bathe, use the antiseptic wipes that were given to you in pre-admission testing. Do not apply to the face or genital area. Allow this to dry for several minutes before putting on clean pajamas. Practice deep breathing and relaxation techniques. This exercise will help with anxiety and pain relief post-surgery. Do not shower or bathe in the morning of your surgery. Just brush your teeth and dress in comfortable, clean clothing. You are now ready to head to the hospital for your surgery. Here's a list of items to bring with you to the hospital: a photo ID, insurance card, allergy list, medication list with dosage, shoes and comfortable clothing, toiletries, book, magazine, or other reading materials, glasses, dentures, and hearing aids, a CPAP or BiPAP if used at home. Here is a list of items you should not bring with you: medications unless your doctor has instructed you to, limit cash to copay, credit card, debit card, and one check only, jewelry, anything of value except those mentioned above. We cannot be responsible for lost belongings. Your anesthesiologist will formulate the best and most appropriate medication regimen to control your pain. Remember, this plan was initiated in pre-admission testing when you met an anesthesiologist. You may or may not have the same anesthesiologist. However, notes were taken that day to assure that your plan was communicated. Rest assured, your comfort is our top priority, and the anesthesiologist will see you on a daily basis to assess your pain level and any side effects from pain medication, if any, and adjust the plan accordingly. Please remember, you will not be pain-free. The anesthesiologist and nursing staff will do everything they can to ensure that your pain is manageable. Medications may be administered orally or via an IV. On the day of surgery, report to the information desk in the main lobby and you'll be escorted to ambulatory surgery. You'll be greeted by surgical staff and the pre-op process will begin. Your identification bracelet will be applied. Due to COVID-19 restrictions, your family members will not be able to join you in ambulatory surgery. They will be notified when you are in the recovery room. Good Samaritan Hospital now offers a new and innovative way for family members to stay informed during and after your surgery. It is an app called Family First. For example, you may receive a text saying the doctor is finishing up and will talk to you in 15 minutes. This is a one-way app that you will set up on your phone during registration the day of surgery. The staff will gladly assist you in setting this up. Once you're in the ambulatory surgery room, you will change into a hospital gown. Blood work may be drawn as needed. While you're in the holding area, an IV antibiotic will be started. You'll meet your anesthesiologist, nurse, and surgeon. Your chart will be finalized, and your operative site will be marked by your surgeon. Your block will be started at this point. This is the block that will keep your operative extremity numb for some time after surgery. You'll be asked your name and date of birth several times to confirm. At this point, your RV is started, and your anesthesiologist can give you some medication to relax you. Please feel free to ask for this. Many activities go on in the operating room at the same time, but do not feel anxious. This is routine. There will be staff hooking up to your monitors, and your spinal anesthetic will be administered at this point. It's very cold in the OR on purpose, but we will provide warm blankets to keep you comfortable. Post total knee, total hip, or total shoulder replacement, you will be cleared from the recovery room and transferred to an orthopedic floor. The nurse will assess you, and once you are stable for out-of-bed activities, the physical and occupational therapist will evaluate you. You may experience some symptoms such as nausea, dizziness, and numbness post-operatively, post-nerve blocks, and post-anesthesia. You may experience onset of pain to your surgical leg. There are 4 basic steps to a knee replacement: prepare the bone, position the metal implants, resurface the patella, and insert the spacer. You are given 3 blocks prior to surgery. You may experience numbness the day of surgery into post-op day 1. You will be provided with a knee immobilizer to your surgical leg to prevent from buckling from numbness. The brace should be worn the day of the surgery into post-op day 1. Thereafter, you can take the brace off in bed and in the chair when resting, but it must be worn at all times with all the weight-bearing activities. As numbness wears off, you will experience some surgical pain, which will be managed by a team with pain medication, mobility, and icing. You will lay in bed or sit in a chair with the surgical leg extended with a towel rolled under your ankle. Your toes must face the ceiling at all times. We want to promote as much knee extension as possible. The physical therapist will provide you with exercises to increase range of motion, strength, and circulation. There are 4 basic steps to a hip replacement. The damaged femoral head is removed and replaced with a metal stem. A metal or ceramic ball is placed in the upper part of the stem. Damaged cartilage is removed and replaced with a metal socket, and a spacer is inserted. As stated before, once you are cleared for out-of-bed activities, you will be evaluated by a physical and occupational therapist. With a total hip replacement, you'll have to follow 3 main total hip precautions. The first is the use of an adduction pillow between your legs in bed, which will prevent you from crossing your legs. You'll continue to use the pillow when you go home as well for the first few weeks. The second is to maintain your hip at a 90-degree position. This means you cannot bring your knees above your hips. You will sit in a high chair to prevent your knees from going above your hips. You will know the chair is right for you when you back up into the seat. It should hit the bend of your knee or above. You should not bend down to pick up anything off the floor. The occupational therapist will provide you with tools for lower body dressing and other tools for compliance. Do not internally rotate your surgical leg. This means do not place your surgical leg in a pigeon toe position. When turning towards your surgical side while walking, make sure to turn your surgical leg outward first. Damaged parts of the shoulder are removed and replaced with artificial components, including the replacement of the humeral head and the replacement of the ball and the socket. You will have a sling on the surgical arm. You cannot bear weight on the surgical arm. You're not allowed any range of motion to the surgical shoulder, but you will be allowed to remove the sling to perform a range of motion activities to your elbow and wrist. Physical and occupational therapists will review elbow and wrist exercises. You will learn how to take off and put on your sling. The occupational therapist will educate you on proper and safe upper body dressing techniques to remain compliant with total shoulder precaution. You will be in post-anesthesia recovery room or PACU for 1 to 2 hours. You will remain hooked up to monitors such as an EKG monitor, and you will still have your IV. You will also be on oxygen. You may or may not have a drain at your surgical site. Coughing and deep breathing are encouraged, and you will start to use your incentive spirometer. Family members will be able to visit, but only briefly. The surgeon will be meeting with your family. You will be asked multiple times on a number scale how severe your pain is. 0 equals no pain, 1 to 3 is mild pain, nagging, annoying, interfering with activities of daily living. 4 to 6 is moderate pain, 7 to 10 is severe pain, disabling, unable to perform activities of daily living. We actively work to minimize complications after your surgery. Here are some of our strategies. Dislocation. Dislocation of the new hip joint can be minimized by following specific hip precautions, which were provided to you in the book you received from your surgeon. These will be reinforced by your physical therapist and occupational therapist while in the hospital. Infection. Infection can be reduced by keeping the dressing clean and dry. You will have a waterproof dressing, and you will not be able to shower until you leave the hospital. You will be given an additional dressing for home that you can change 1 week after surgery. Call your doctor if you have a fever greater than 101 degrees or if the incision becomes red, swollen, or begins draining an odorous fluid. Future surgeries. After placement of your new joint, it is best practice to have no future surgeries or dental work for 90 days. You may need preventative antibiotic treatment. Deep vein thrombosis or pulmonary embolism, which are blood clots that form in your legs or lungs. We combat these with exercise and ambulation. You may also take medications such as Lovenox and aspirin. Patients that have been taking anticoagulants prior to surgery for other health issues will continue the previous medication when discharged from the hospital. Additionally, you will use compression devices over your calves and feet to help prevent DVT or PE. Compression stockings or ACE wraps can also be used. Most surgeons like compression stockings to be worn for 2 weeks after your surgery. You'll be given an extra pair of compression stockings upon discharge from the hospital. Legs and ankle swelling. Elevate the operative leg to minimize swelling. Avoid sitting for more than 30 to 45 minutes at a time and perform your ankle exercises. Pneumonia. Using the incentive spirometer will help minimize the threat of pneumonia or partial lung deflation. Doing your breathing exercises with the incentive spirometer will also reduce your risk. Welcome to our brand new state-of-the-art orthopedic unit. This unit, designed by an orthopedic team, opened in August of 2019. The unit is complete with private rooms with ensuite bathrooms, large screen TVs, and an in-unit physical therapy gym with multi-purpose gathering areas. Our goal is that all elective joint replacements go home post-op day 1 or day 2. Have a plan so you can go directly home. Studies have shown that patients that go directly home after joint replacement have better outcomes than patients that go to a subacute rehab facility. On post-op day 1, you'll be seen by a physical therapist, occupational therapist, and nursing within hours of your surgery being completed. You will ambulate, usually within 4 hours of being discharged from PACU, as long as you are medically stable. You will be seen twice a day by PT and OT during your stay, and on your discharge day, it will not be until the afternoon generally. We'd like for you to have PT and OT in the morning, have lunch, and then another round of therapy in the afternoon before you go home. You will also be seen by a case manager prior to discharge to make the arrangements for therapy at home and to get any equipment you may need for a safe discharge. Here's what to expect in your post-op day 1. Please read the list on this slide. After your surgery, please do not get out of bed yourself. This is the day you will have the most residual pain. Post-op day 1, your antibiotics and IV will be discontinued. Bathing will be done with hygiene wipes or at the sink in your private bathroom. Your surgeon or surgeon's partner or PA will visit and examine the wound and your movement. You will be seen by a case manager for discharge planning. You will have PT and OT twice daily. You will be wearing mechanical pumps on your calves and or feet. You'll be encouraged to use your incentive spirometer hourly, if not more. You'll also be encouraged to do exercises while in bed. The physical therapist will show you these, and they're also in the book that was given to you at your surgeon's office. Practice prior to your surgery as well. You will be encouraged to drink lots of fluids. You will also be using the gym at the back of the orthopedic unit. This gym has a staircase that you'll be practicing on, as well as a car module and tub to practice getting in and out of safely. Rehabilitation after surgery. If you have not been discharged by day 2, today your pain will be substantially improved. This day looks just like day 1, only things will be much easier. You should be discharged in the afternoon. You should have prescriptions for pain control and for post-op anticoagulant. You should have your extra dressing and additional pair of compression stockings. You should also have an appointment scheduled with your surgeon for 12 to 14 days after the initial surgery. Arrange for transportation to your home in the afternoon. Now that you are home, physical therapy will begin daily for the first week and approximately 5 days the following week. If more PT is needed, that will be at the discretion of the physical therapist. If recommended, more PT will be arranged either in the home or as an outpatient. Please review the following information about how case management can help you prepare your home for your return and helpful reminders about positioning and exercises. We hope this was informative for you. If you have any questions or concerns, you can contact Jennifer Cassidy, the Orthopedic Joint Coordinator, at 845-368-5644 or 845-422-6949.